Talkopolis, the social media TV network for your city.
Hi, thanks for joining us again for the National Fitness and Beauty Roundup. We are back with Tracey Robinson of Trace Skincare, so check back to hear more about her treatments after the break. Tracey, let's talk a little bit more about some of those treatments we kind of brushed across, but let's go into maybe from, I don't know, maybe simplest to maybe more
invasive.
More invasive,
sure, yeah. Sure. So after I see the client, and I do get photographs with a photo finder camera system, we talk about least invasive and most invasive treatments. Exfoliating is kind of a general term that I use for micro-dermabrasion, derma-planing, really those two treatments. So micro-dermabrasion is I have a diamond tome machine, and it's a diamond encrusted wand that's hooked up to a vacuum, and you have a fine, medium grit, and one for the body that's going to be a lot coarser. Sure. And so just, with pressure, you run it across the skin. This is something that the client can do and go back to work, and they might be a little pink, but you can put makeup on afterwards, and it just helps exfoliate that stratum corneum, or the dead skin that accumulates.
Yeah, allows new
over
skin
time.
cells to grow, basically.
Right.
Okay.
So that's something wonderful to do. Derma-planing is using a scalpel. Sounds kind of scary, but and it's just a technique, and it's run. The scalpel, I kind of divide the face up into small credit card sized areas and go over it, and it will remove that vellus hair on the skin.
Oh.
So now that will grow back in 6 weeks approximately, but just as soft and fine. It's a myth that, shaving or any sort of dermaplaning work would make the hair grow back thick.
Right.
That's not true.
Right.
So, but you're also scraping off that dead skin layer.
So it's a little deeper than the micro-dermabrasion?
No. They're probably pretty approximate
Similar
to one another.
Okay.
Yeah. So then after that, I have chemical peels.
Okay.
So we're still just working kind of with the surface of the skin, and those vary from superficial to medium to deep. So they help with discoloration, fine lines and wrinkles, melasma,
really? So you can take
acne. So there are various problems, and I tend to have to work with the clients how much recovery time he or she has. So, a superficial one, you're going to be able to work out the next day. There's not going to be a whole lot of peeling. It doesn't mean it's not effective, but a medium depth one is going to be more up to a week, and a deep one, maybe 2 weeks.
Okay. Before everything looks the way it's intended.
Right.
Okay.
Right. And again, it's always more than one treatment.
Sure.
I mean, there's not anything that I do that's just a one-time fix. It's like a muscle. You have to challenge it, and then once you get it toned, you have to maintain it. So I think a lot of women come in wanting that one time. Can't I just do something once this year?
Right.
No.
Okay.
I wish.
Because it's a growing organ.
Right.
So it's got to replenish
constantly
cells,
changing.
but if you were to do
Exactly.
too much, obviously it'd be more than someone would really want to bear.
Exactly.
I'd imagine if you try to all that in one shot. Yeah, it's just like a workout would be too much. We kind of fix your whole body in one week. So,
exactly.
Yeah, it doesn't work. Okay.
So, and then after chemical peels, or, right in there, I have lasers. I have 2 lasers. I have a Cynosure's Apogee Elite, and I have Cynosure's Smart Skin Fractional CO2. I'll talk about the first one, the Apogee Elite. It's 2 wavelengths in one box, a 1064 nanometer and a 755, and I can treat discoloration and unwanted hair. So redness, broken capillaries, pigment You know, I make sure that the clients have seen a dermatologist.
Sure. Make sure it's not something
Right,
that's
right.
needs to be treated.
Moles, I can't do.
But like sunspots?
Sunspots.
Okay. So you have many people coming in for their hands and arms. I know a lot of people do face, but do
Oh, absolutely. Hands, arms. I tend to stay away from legs. That just the sun damage on the legs is different, and it doesn't work as well.
Okay. Skin's different.
Skin's different.
Okay.
And hair removal, and I can do hair removal on all skin types, from Caucasian to African American, safely with my 2 wavelengths. So that's wonderful. It is hair reduction. I should
so it makes it real
not
fine.
say removal.
And
it's laser hair reduction.
Okay.
So yes, it thins it out, makes it fine, and can last years.
Oh wow.
Yeah, that's great.
I wouldn't have to shave again.
So, right.
I hate shaving.
I do a lot of men, their necks.
Horrible. Hate it. Yeah, that's miserable.
And then the other laser is fractional CO2, and it's resurfacing. So it generates columns of heat that is produced in a pattern, and then there's healthy skin in between. So it's ablative, so we're essentially burning the skin, and we're initiating collagen stimulation.
Gotcha.
So, and those can be light, and they can be really deep, again, depending on kind of the goal of the patient. And that's a wonderful treatment.
Just makes skin kind of fill out a little bit like when we were 20.
Well, right.
Well,
It helps to erase the fine lines and wrinkles and stimulate collagen.
Right, collagen. So that's the useful part of the skin that supports it.
Right, right. An alternative to that is microneedling, which is not as invasive and not as expensive. So for my client on the go, microneedling, either using the derma pen or the micro pen, can sound a little bit more appealing. So there's really there's no recovery time to that.
Gotcha.
I know the word needle is in there, but it does not hurt. We numb the skin and needle in either a hyaluronic acid topical or platelet-rich plasma, which leads me into the next kind of grouping of treatments that I do, which have to do with injections. So Botox cosmetic.
Okay.
Which I know we've heard a lot about.
Yeah, there's a lot about that. Well, let's take a break on that one.
Sure.
Let's come back and dig into that for the next segment. That's interesting. I've not heard of the platelet
rich plasma.
Right. And of course Botox. We can talk about that for a few minutes. So let's take a break, and we'll be right back. So you're going to want to hear more, because I'm sure you haven't heard of this either. Thanks.